Hey guys, it's Dr. Childs here. Today we're going to be talking about one of my supplements, Thyroid Hair Regrowth Complex. We're going to be talking about what it does, how it works, how to use it, and a whole bunch of other information. We're going to be talking about some myths and some FAQs and things like that. So if you're looking at this supplement, if you're considering using it, I would recommend you watch this video all the way through and also read the information that I have directly on the product page because all of this information is there in some form. So Thyroid Hair Regrowth Complex. What does it do? Well, hopefully by the name that's pretty obvious. It helps your hair grow, and it's specifically designed for patients who have thyroid disease. So it does this, like I said, supports hair growth in thyroid patients. It does this primarily by helping to enhance specific proteins which are necessary for the growth of your hair. Those include things like collagen, elastin, and keratin. And if you know anything about these proteins, you know that these proteins are also found in your skin, also found in your nails, and of course found in your hair as well. So whatever this is doing to your hair is also going to help these other cosmetic or aesthetic features of your body as well. And then of course it does this by containing ingredients which are stimulating to hair regrowth. And that's specifically how it's going to work. We'll be talking about that in a minute. First, I want to talk about hair loss, though, and this is going to be very important to all those people who are listening to this, especially thyroid patients, because I don't want you to think that this supplement is something that it isn't. Okay? Now, I want you to realize that hair loss is a very complicated thing. It isn't always a complicated thing, but it can be. In my experience, it's either usually fairly simple or pretty complex. First of all, let me just say there is no such thing as a supplement which addresses all of the potential causes of hair loss. There is no such thing, and if you're looking for that, you're looking in the wrong place. Now, what these supplements do, though, is they can address and target certain areas or specific things. Now, Thyroid Hair Regrowth Complex is more broad in its approach because it helps improve hair growth cycles. Okay, it's providing the nutrients, and it's just helping the hair grow better than when it was growing before. However, there are things which can limit your body's ability to grow at all, your hair, right, and your nails as well. So you need to be aware of at least some of these things. This isn't a comprehensive list, but I want you to at least understand how this is all fitting together. So one of these things would be nutrient deficiencies. Now, Thyroid Hair Regrowth Complex sort of fits under this umbrella term of nutrient deficiencies because it provides certain specific nutrients which are very helpful for hair regrowth. Okay, but there are other things as well which are necessary for your hair to be able to grow. Number two, very important for those patients with thyroid disease, and that is thyroid deficiency. You should know that if you don't have enough thyroid hormone, your hair is not going to grow very well. So if you're taking Thyroid Hair Regrowth Complex, when in reality you should be on thyroid medication, it's not going to solve that problem. Okay, so I just want to be clear on that. I don't want you to think this supplement is something that it isn't. It does not contain thyroid hormones. It helps your hair grow by stimulating the hair regrowth cycle. If you are low on thyroid hormone, I suggest you get that problem fixed. Now, that doesn't mean that this can't also help your hair grow, even if you are not taking a sufficient amount of thyroid hormone, but you should realize that the effect will be enhanced if you are also taking thyroid hormone or if you're taking thyroid support supplements, which we'll get to in a minute, because you can increase your thyroid function either by taking medication directly or you can also take thyroid support supplements. Another big one you should be aware of is iron deficiency. So a lot of thyroid patients have very low iron, and you can diagnose this by just looking at ferritin levels or serum iron or a combination of both and some other lab tests and so on. But this supplement does not contain iron, and iron is necessary for hair growth, and many thyroid patients find that they're also iron deficient. Again, this will still help in that situation, but it's not a solution to iron deficiency. And then the last one is genetic/autoimmune disease. So this is not a supplement which targets those things. Again, it may help in these situations, but if your main issue is an autoimmune disease or the fact that you were just born some way and you have this genetic issue, that's going to be a little bit more difficult to treat. So I don't want you to think that this is an all-in-one supplement that addresses all of these problems. It is primarily addressing the nutrient deficiency category, which in my opinion, many thyroid patients suffer from. Furthermore, it also is more broad in its ability to help, and so I think that's why it's more, it can help a lot of these other conditions, but you should still address them if they're present. So let's talk for a minute just about how it works. So as I mentioned before, it supports elastin, keratin, and collagen production. These are probably the three most important proteins because they are very important for the structural integrity of these objects. So your hair, your skin, and your nails. And it does this by containing a combination of certain ingredients. But it's not just the ingredients that help. It's actually a patented way of getting those ingredients into your body, which is a choline stabilized orthosilicic acid compound, which is attached to all of these things, except for the biotin. So what it does is it contains a combination of biotin. You know biotin probably because it does help with hair. regrowth by itself, but this is not really why we're using it in this case. In fact, I think the more important ingredients are choline and silicon, which are again attached to this choline stabilized orthosilicic acid. And what these are doing is they're helping your body to absorb these ingredients. Because remember, just taking something by mouth doesn't guarantee that it gets absorbed. Why do you think we have all these rules about how you should take thyroid medication, about how you should not consume it with food, about how you should not consume it with coffee, about what time of day you should take it, and so on and so forth? All of those recommendations are to try and increase how much is actually getting absorbed into your body. It doesn't matter that you swallowed the pill. Swallowing the pill doesn't guarantee that it gets into your body. The same thing is true with these nutrients. They must be absorbed. And this patented technology is what helps the absorption process occur. So it can ensures that when you take it, or it ensures when you take it, it's actually getting into your system, getting into your body, and being utilized by your hair follicles and so on. So that's really the trick, or whatever you want to call it here, and that's why it's so effective in my opinion. And in fact, the reason I say that is because it actually has some clinical studies showing that this complex has been very successful, and that's why it's patented technology. And so, in my opinion, this is, there's not a lot of supplements which can make this claim, and so that's why I make mention of this, because it's fairly important. So the dose for skin, hair, and nails is all the same, and this is the the dose which has been tested in these clinical studies, which has shown a statistically significant improvement in these areas. And so it's 2 capsules per day for each thing. So if you're taking it for your hair, 2, 2, and 2. So it makes it real easy, but we have to break it down like that because that's how it was in the science and the study. So I'm just regurgitating it back to you. So 2 capsules per day for each of those things, which is the recommended dose on the bottle. So you don't really have to worry about it. Just take 2 per day, and you're there. And then, of course, I've already talked about it. It improves the absorption of choline plus silicon with the orthosilicic acid, and ensures that those things actually get into your intestinal, or they get through your intestinal tract and into your body. The other thing is that what's really important is talking about who should use it. And so we kind of touched on that briefly, but I want to go over that just really quickly here as well. So in my opinion, pretty much any thyroid patient with hair loss should consider using it. Because again, it's very broad in its ability to address some of these issues, and it at least touches base, or it has a foot in all of the different camps that we talked about previously. So it's generally helpful if you're having hair loss to any degree, really, and you also have thyroid disease. Now, having said that, in my opinion, there are certain people who obviously tend to be impacted more by their hair loss than others, meaning that they find that it's, what should I say, it's more concerning to them that they're losing a lot of hair compared to other people. Some people don't worry about it when they've lost a lot of hair, but if you're one of those people who does worry about it because, it's a cosmetic issue and it can affect your confidence and so on. And so if that's you, then you definitely want to be taking something like this, because obviously you want to do whatever you can to help with your hair growth. And I also have another list of people which include those with hair breakage, those with hair loss, those with accelerated aging, so increased wrinkles and age spots. And the reason I mention that is because if you know anything about anti-aging medicine or the cosmetic industry and whatnot, a lot of their products focus on increasing collagen, elastin, and keratin, because these are the things that as you age, they start to diminish. And so these are the things that cause those characteristic fine lines of wrinkles, or wrinkles in your skin and so on. And so by increasing these things, which is what a lot of cosmetic products tend to claim that they do, that's how you can sort of reverse this aging process. So again, it's very important for the skin. I don't want to throw the skin out here, but we call it thyroid hair regrowth complex because, again, thyroid patients tend to predominantly they deal with that issue more than they do with skin issues. They also deal with a nail issue, though, for sure. And coming to that is our next one, which is if you have weak or brittle nails. That's a sign of nutrient deficiency. It's also a sign of thyroid deficiency, and so you can support that. And then, of course, if you have any skin changes, so dermatitis, rashes, or eczema, because of the way that it helps impact your skin. And then reduce wound healing, which may or may not be relevant to many of you here, but it can help in those situations as well. The one thing that I want to point out as well is that thyroid thyroid hair regrowth complex can be combined with thyroid support supplements. And so remember, as I said previously, that there's 2 separate things going on here. So you have the nutrient deficiencies, which can be contributing to the hair loss, and then you have your thyroid issues, which can be contributing to the hair loss as well. And just taking thyroid hair regrowth complex is not going to fix the thyroid problem. However, if you recall earlier, I did mention there are certain things that you can take which support your thyroid, which are supplements that you can take, which naturally increase your body's ability to produce thyroid hormone, to convert thyroid hormone, and for thyroid hormone to be activated at the cellular level. So the reason I'm bringing this up is because you can, of course, add thyroid hair regrowth complex to a thyroid support supplement regimen. And this is the one that I recommend. So if you've been on my blog, I would assume that you probably have already been introduced to this, but I'll at least just mention it here. And again, this is something that if you know that you're perhaps not on the right type of medication for your thyroid, or your doctor's not willing to prescribe that type of medication that you need, or you're on medication, you're just not feeling well, so on and so forth. Any of these things mean that you could probably gain some benefit by using supplements which naturally support your thyroid. So I have this combination here. These 4 specific supplements are the ones that I consider the full thyroid support line. So that includes thyroid adrenal reset complex, which is more of an adrenal thyroid supplement, T3 conversion booster, which is primarily a thyroid/adrenal supplement, functional fuel complete, which is a plant-based vegan protein powder, which also contains a lot of important nutrients for thyroid function, and then of course an iodine supplement, which is important for hair growth as well because it supports your thyroid. So I want to mention here that you can use thyroid hair regrowth complex with all of these, so don't worry about that if you're already taking them. And if you're not taking these, that's fine too. There are other thyroid support supplements that you can be using. I just think that this covers all of your bases. So let's talk a little bit about myth busting / FAQ, because we get a lot of questions, especially on this supplement. There's a lot of patients who suffer from hair loss, and I feel I don't have hair loss, but I understand that it's a big deal. And so let me kind of go over some of these questions, and we'll hopefully answer some of these things. So, how long will it take for me to see a difference if I'm taking the supplement? Now, remember, hair doesn't grow back quickly, okay? So your hair regrowth cycle is on a several week cycle, so it takes quite a while. But what I generally say is most people, in fact, let's come up here. I think I didn't talk about this, but before I was talking about, this is a screenshot of the reviews that are currently on this product. So there's 177 or so. And so what I wanted to show here is we don't edit or anything like this. So that what you see is what you get, the good and the bad. It's all there. But what I wanted to point out here is there's 71% 5-star and 16% 4-star. And so I'm only using this as a proxy to help you determine that approximately about 8 out of 10 people find either significant to moderate improvement while using this. So, and again, I'm only bringing this up to show you that this other 20% probably have some of these other issues. So remember, it's not this all-in-one thing that I'm mentioning, but there's still a lot of people who can benefit from using it. So this comes to the question of how long will it take for me to see a difference. And that kind of really depends. So if you look on those reviews, you'll see some people who notice an improvement almost immediately. In fact, they've actually accused me. I've had emails where people say, "Why would you make up this review or lie?" I'm like, I don't touch the reviews. I don't do anything with them. But I have seen a handful of people who just notice a difference almost immediately. Now, what I would suggest to you is that's probably because as they're taking the supplement, it just so happens that they're probably either right before or right after a hair regrowth cycle, which you don't really have control over. It just is occurring in your body at any given time. But if you happen to supplement right when it starts, then maybe it boosts it almost immediately. That's just a theory that I have. I'm not 100% convinced that that is the case, but I have seen that happen, and you'll see those in the reviews. For most people, though, I would say you need to take it for at least 6 to 8 weeks, maybe even 4 to 6 weeks, but somewhere in that 4 to 8 weeks range. So 1 to 2 months should be enough time if it's going to work that you will see a difference. If you don't see a difference after about the 2-month mark, it's unlikely that you're going to see a significant difference. And I say that because I've had a couple people who just continue to use it, past the 2 or 3 month mark, and it doesn't work for them. And if it's not going to work by that point, it's probably not going to work for you. But at the same time, you have to give it time. Your hair just doesn't just pop up overnight. I mean, in fact, there are several people, if you read the reviews, you'll see some people who have been taking it for 4 or 5 months who just continually see a gradual increased progression of hair growth as they continue to take it. And a lot of them won't even necessarily realize that on their own, but they hear it when they go back to their hairdresser, and their hairdresser is, cutting their hair or whatever it is what they're doing there, and they'll make mention and say, "What are you doing to your hair? Because it's getting thicker." And that's something that I'm not particularly good at noticing, but hairdressers, of course, would be. But yeah, maybe you will be able to know that if you do ponytails or whatever it is. But pay attention to that. Realize that it may take about 4 to 6 weeks, maybe 6 to 8 weeks for you to see some improvement, but then you'll get continued progression of improvement as you go on for several months. Will it work for me is the next question I get, and the answer is I don't know. Like I said, if you use the reviews as an indication as to whether or not it'll work, I mean, you have about there's an 8 in 10 chance that you'll see, again, significant to moderate improvement, because those are the 3 or the 4 and 5 star reviews. The 3, 2, and 1 star reviews are people that probably just didn't work that well. Doesn't mean it didn't work, just means it wasn't necessarily a huge improvement. But I will say that if you just look at that, I would say it's fairly accurate that about, there's an 80% chance that you'll see moderate to insignificant improvement. But again, if you're taking it and your main issue is an autoimmune disease, then I would say the chances are probably a lot smaller because this is not an autoimmune supplement. But if you are taking thyroid medication, if you have hair loss, if you sort of fit that standard mold, and you got brittle hair, your hair's breaking, your hair's falling out, then this is definitely this supplement was made for that situation. Okay. The next question is, what if my hair loss is related to hormones, genetics, etc.? Again, it kind of goes back to the question I just said before. If you can, you should try and figure out what your issue is. Now, I realize that's very difficult because a lot of doctors don't think about hair loss in the same way I do. They just, they might just ignore it, or they don't have any solution for you, or they may tell you to go take minoxidil or whatever, something like that. But if you can, at least look into your hormones, look into your genetics and so on, and you'll be able to tell. And worst case scenario is you can just try the supplement to see if it helps, and if it doesn't, and you can return it within 30 days if you're within that 30-day time frame. So you have a couple of options there, but no, I don't know for sure if it will work for you. But there is still some potential benefit even if you have the hormones and the genetics and so on because of the way that this helps. Remember, it's helping to increase the structural integrity of your hair, skin, and nails themselves. It doesn't necessarily help support the growth of them. I guess it does help support the growth of them by providing the precursors, but it's not a stimulating factor such as your thyroid would be in that case. The last question is, what if I don't have a thyroid? Will it still work? And yes, the answer to that is yes, obviously. Because remember, even if you don't have a thyroid, you still need thyroid hormone. So you're still taking it anyway. And so the thyroid is still getting into your body from the medication you're using and acting on the hair. Now the difference is those people who are reliant upon thyroid medication tend to suffer from more nutrient deficiencies than those who have a thyroid. So if anything, they'll need this plus some other things. But yes, it will still work because your hair follicles remain intact whether you have a thyroid or not. So hopefully that answers that question. So that's pretty much it. If you guys have any other questions related to this particular supplement, please, email or leave a comment below. We'll do our best to get back to you as soon as we can. You can also contact us on our contact page. And last thing I wanted to say is, of course, all of the supplements that we have or that I have are organic, gluten-free, dairy-free, soy-free, non-GMO. They're made specifically for thyroid patients, so I keep all these things in mind. And they're produced in the U.S. In a GMP-compliant facility, if you know what that is. They're NSF and NSF Sports Certified and TGA Certified, which is the highest standard of that supplements can get here. So, and they're third-party tested and verified to have the ingredients that we claim that they do. So, again, if you have any questions, let me know, and otherwise, I will see you guys in the next one.